Good afternoon, Tallahassee. I'm John Dailey. I am your mayor. I'm joined with my great friend, Dr. Reeve, who is the CEO of the Apalachee Center. We're here to talk about mental health issues in our community during the COVID-19 global pandemic. I want to thank you for joining us on Facebook Live. Of course, we've taken the appropriate measures. It feels a little strange to sit so far away, but this is what we do, and we got to lead by example as well. Jay, this is Mental Health Month. And first of all, thanks for joining. Really do appreciate it. And let me also state to those that are watching, I'm sorry, please submit your questions. We'll be taking questions live as well. So send us your questions and we'll talk about them and answer them to the best of our ability. But this is Mental Health Awareness Month.
Yes, it is.
How appropriate that we are having this conversation. We're a month in of the stay-at-home order. And, you know, people are getting a little antsy, and everybody's dealing with their own issues. So I thought it was appropriate for us to come and have our second Facebook Live talk about mental health issues during the coronavirus pandemic. Look, we spend a lot of time talking about physical distancing. We spend a lot of time talking about the CDC guidelines. We spend a lot of time talking about wearing your mask and taking care of each other with the physical aspects of health. But again, you and I are committed to continuously elevating the conversation on mental health issues, and specifically, obviously, here in Tallahassee.
Absolutely.
So I appreciate you joining me. Let's start off. What are you seeing in general platitudes? What are some of the things as a community we should be paying attention to?
Well, thanks, Mr. Mayor. First of all, thank you for having me on. And
Sure.
As always, thank you for keeping mental health issues in the forefront of what we're doing in this community. It's been a really interesting month and a half in the mental health world. So here's a couple of things that we've seen, some surprises and some things that were not so much of a surprise. There's a general tenor in the communications that we have from the community of heightened levels of anxiety.
Right.
And we had talked about that a little bit the last time that we met, that's what we thought was going to happen, and that is what we did see happening. So the trend for Apalachee Center, and I think this is true for other mental health providers as well, was really fascinating because last week of March through probably the third week in April, we saw a pretty dramatic drop-off in contact on our outpatient side.
Wow.
Now, residential, inpatient, stayed strong, and I want to come back to that in a minute because it's kind of an interesting thing. But on the outpatient side, folks were calling their doctors once in a while, but they weren't coming in so much. Then and of course they couldn't come in because while this was happening, along with most other mental health providers, we were making a dramatic leap into telemedicine. We'd had that for a while, but we were able to really push out our ways to contact folks remotely. Around the third week in April, we saw things start to turn around, and so the numbers started to climb. So we are now again seeing volumes that are pretty commensurate with the middle of March in terms of people reaching out to us about mental health issues. We've actually seen an increase in patients on the outpatient side.
Oh, wow.
What's really interesting is the number of contacts have gone down, and we think that has to do with people are sheltering in place, people are, following social distancing guidelines, but they still need to reach out. They still need to have some connection, and they still need to get help when they need it. And one of the things we also saw, and this was really unexpected for us, as you remember, you gave the great keynote address a year ago when we opened our expanded children's unit. So the way children's psychiatric units work is that typically in school holidays, in the summer months, the numbers drop off pretty dramatically.
Right.
It's when kids are in the school, that's when I think a lot of times that's when things are being seen. That's when the unit fills up. So we expected the numbers in our children's unit to drop pretty dramatically. They really didn't.
Wow.
Things kept, they kept pace with where we thought they were going to be. So what we've seen in terms of the Apalachee world is that the services that we're providing have continued to be utilized. There's continued to be a demand for them. But there's some things we haven't seen, too. We haven't seen a huge spike in the numbers of folks calling up our crisis hotline. We didn't know whether we were going to get that or not. It's kept pretty much pace with where it was in the past, but it has not expanded. And here's the theory behind that. Remember we talked about this a little bit a few months ago, too, or a month ago, when there's something like the pandemic that hits, this is true for every kind of natural disaster, hurricanes, other kinds of issues, people tend to not seek help right in the midst of the trauma.
Sure.
It usually takes about 6 months. So what we're anticipating, I think we're starting to see the brief upticks of this now, but we're anticipating towards the end of summer, the beginning of fall, there's going to be a whole lot of demand for service.
Sure. Well, I would imagine that some people are in the survival mode.
Exactly.
It's really tough during normal circumstances, and that's probably why right now they're not necessarily seeking help, but you're going to see the increase.
I think that's exactly right.
I'm joined by my good friend, Dr. J. Reeve, the CEO of the Apalachee Center. Full disclosure, I've served on your board now for about 12 years.
About 12 years, that's right.
It's an incredible facility, the Apalachee Center here in Tallahassee. And I'm glad that you're joining us during Mental Health Awareness Month to have this conversation. Thanks for joining us on Facebook Live as well. Jay, you just mentioned something that's very interesting, anxiety.
Yes.
Okay. So I've had a lot of conversations with people in the community about anxiety. On a day-to-day normal level, we all have anxiety to deal with. And we're also trained to deal with crises differently. Hear me out. We're used to hurricanes. We've had 3 hurricanes in 4 years.
Right.
And when we're talking about hurricanes and preparing for crisis, we know a storm is coming, we prepare. We have the storm event, we hunker down. And then after it's gone, we assess the damage, we roll up our sleeves, we start cleaning up and helping our neighbors. But there's a defined end to it.
Right.
A lot of the conversations I've had with people around the community, some anxiety stems from the fact that there's no defined ending that we have been able to identify right now. We're all kind of in this global pandemic together. We're all, as a global community, let alone as a local community, trying to figure out how we're going to move forward. But I think that really, it's something we're not used to, and it's creating a higher level of anxiety than even, say, a hurricane would, or something like that. And then you have the new normal, right? Hey, I have anxiety trying to help my kids out with their homework.
Right.
Because it's different. It's a new schedule. My kids have anxiety because classes are online. They're not seeing their teachers and their friends as much, except for, virtually. And so it's all different types of anxiety. It's all different levels of anxiety. But you touched on that. And so, let's dig in a little deeper on that as well. Okay? So we got a bunch of questions that have already come in. If you have questions, please submit them to us, and we're gonna talk about them live. But one of the questions that was sent in was, how can I tell if the pandemic is having an effect on my children's mental health? Like, what are some of the signs, if you have kids, that we should be paying attention to make sure that, we're all staying abreast of the issue?
Yeah, it's a great question. And you kind of alluded to this in talking about anxiety. It's important for people to remember that anxiety is physical. We're not talking about something that people are making up in their head. We're talking about a literal chemical release of adrenaline into the bloodstream and into the neural networks.
Wow.
It prepares folks. It's the old fight or flight response. Folks are prepared to take action, to get away from what they perceive as the source of danger, and anxiety comes from sustained experiences of that. The pandemic, as you pointed out, is one of the more sustained experiences of something's happening that could be a danger to me in a long time.
Right.
And then there's another layer to it too, and you also alluded to this in terms of changing schedules. So one of the ways that both adults and kids, and this is really important for kids, keep anxiety at bay, is that there's a routine, there's a scheduled routine that they can anticipate.
Structure,
exactly. Hurricane comes through, that structure is suspended for a little while.
Right.
But when it goes on for month after month after month, and it's not something that we're used to like this, that's when you start looking at heightened, consistent levels of anxiety. And there's a couple of signs that you can, look for, especially with kids. So first thing has to do with, real simple, sleeping and eating. If you've got dramatic changes in your kids' sleeping patterns or their appetite, that's something to think about.
Mm-hmm.
Now, part of what's going on right now, of course, is people are not getting out as much and there's not as much contact. So sometimes it gets a little ragged around the edges in terms of when's bedtime, when's wake up time, when's meal time. That's all okay. It's more a question of, are your kids staying in bed or wanting to stay in bed many more hours than they usually do? Conversely, are they waking up in the middle of the night? If that's a change from what used to happen, is their appetite decreased? Is their appetite enhanced? And what you're looking for is something that got researched over at Florida State University called behavioral activation. The theory behind behavioral activation is that a sort of physically ordered day in which you wake up around the same time, you go to sleep around the same time, you eat about the same amount, is not only conducive to mental health and physical health, but it's a signal if there's something going on with mental health. So that's kind of the first piece that you'd look at. Second piece that you'd look at really would be more emotional and behavioral. And there's a simple one and one that's less obvious. Simple one is, if you've got a child who's exhibiting a lot of fear, talking about being afraid, talking about the COVID virus, being afraid of the dark in a way they previously weren't, being afraid of, mildly frightening stuff on TV in a way they previously weren't. But then the flip side of that is, do you have somebody, and this could be for kids, it could be for adults, who's having a little more trouble with anger than they used to? It doesn't seem like anxiety at first, but the chemical experience of activation for anger and anxiety are identical. It's just heightened levels of adrenaline. So if you've had a 8-year-old at home who's typically a pretty even-tempered kid who suddenly is flying off the wall and yelling at mom and throwing their silverware, it may not just be that they're being a brat. You may need to think about what might be going on underneath that.
Right. Okay, because this is, let's get down on the nitty-gritty. I mean, we've got 2 boys at home ourselves. It's close quarters. We're all home.
Yes.
I understand that, siblings are going to bicker and the whole 9 yards. But what you're talking about are the more explosive
Yes.
And wild swings in sleep patterns and
Yes.
eating patterns and anger and behavioral patterns. And
Exactly right. Yeah.
Well, you just touched on something, too, which leads into the second question, about if your kids are expressing anxiety by talking a lot about the COVID-19
Yes.
global pandemic. But that also brings up the question, how do we talk to our kids about what's going on?
Right.
And obviously, it's a different conversation for different age levels.
Mm-hmm.
But how do we do this, Jay?
Well, I think you put your finger on it when you talked about it being a different conversation for different age levels. For kids who are under the age, and the rule of thumb that I use is under the age of 10. For kids who are under the age of 10, really the conversation needs to be more about reassurance and safety. You're not going to go into a long explanation of the nature of the pandemic with them. You're going to talk a little bit about people getting sick, and we're trying to keep everybody healthy, and that's mom and dad's job to keep you healthy, and that's one of the reasons we're staying home so much. It's just straight reassurance. The thing that's interesting about the pandemic is that in contrast to other forms of emergencies, public disasters, even in contrast to a hurricane, this stuff's really easy for kids to understand. There's a lot of people getting sick. Everybody knows about getting the cold. People getting real sick from something, and so we're staying home to stay safe. But I think it's the emphasis on the safety and the security that you want to hit for kids under 10 as you start getting older, as kids start getting into junior high and then certainly into high school. Then you start to have more conversations about, the nuts and bolts of what's going on. how viruses spread, kind of what a pandemic is, and especially as kids get to be teenagers, I think there's a lot of conversation that should happen around personal responsibility. And in some ways, if you think about it, it's the same conversation you want to have with your kids about drinking or about driving or any other behaviors or actions that potentially could have destructive consequences if they're not handled the right way. In a pandemic, there's certain things we know are threats to public safety. Mm-hmm. We know that. And so that's conversations, especially with kids who are at an age where they can't really imagine anything bad happening to them, right? The nature of adolescence. Sure. So I think that's kind of how you grade the conversation. You want to go safety first and always for the youngest kids, just comfort. And then as you get older, you want to talk more about specifics, but there's more of an emphasis on what you can do personally to stay safe.
Talk to me about TV. You know, unfortunately, every time we turn on cable TV, there seems to be more bad news that's out there. I mean, how much should we limit our own TV time? Our family's TV time when it comes to the exposure of what's going on, and how do we translate all that? And
well, it's the really interesting question, because there are different ways of handling this for different people, and it kind of depends on what your personal style is. The sort of the broad answer to me is you want to use whatever form of taking in information is going to help you the most. Now, for some people, and this is true for me, I limit the amount of news I watch around COVID, because I know that I can get hooked into watching it for, I can watch CNN for 5 hours at a time and watch the experts come on and off. But if it's not going to alter my behavior, and if it's not going to alter the stuff that I'm doing at work, which it's probably not, if I watch for an hour rather than 5 hours, I don't think in hour number 4 I'm going to learn something that's going to change what I'm going to do, then I'm probably better off not watching it, and that actually helps me kind of focus on the stuff that I need to do, which is really just, take care of my family, take care of Apalachee Center. But there's folks who are the opposite. There's folks who, if they're not having information coming in pretty constantly, that makes them more nervous, because there's a lot of speculation about what might be happening.
Yeah.
So I think the key to that for adults is just knowing yourself. What helps you to stay more functional? Is it checking in on the news regularly? Mm-hmm. Is it giving yourself a news break? For kids, I'm actually a big proponent of not watching the news all the time and not having it on as background, because so much of what happens is heard but not necessarily understood, but can kind of pop up again in the form of anxiety or fear, which is really, especially for littler kids, what you want to limit.
Yeah, it's funny, for TV, we found one of these channels that are playing all the classics, like Andy Griffith,
right,
Gomer Pyle, and all that, and that has become our little source of family TV time, trying to keep it a little bit more upbeat and everything. I'm joined by Dr. Jay Reeve, the CEO of the Apalachee Center, our amazing facility here in Tallahassee. Month of May is Mental Health Awareness Month, and we decided to have this second Facebook Live conversation to talk about mental health during the global pandemic. We've been focusing so much on physical health. We have to keep this conversation alive, and it's an issue that's near and dear to both of us. And let's face it, everybody is either personally dealing with mental health issues, is related to somebody dealing with mental health issues, or knows someone who is dealing with mental health issue. Mm-hmm. But it always seems to be the taboo conversation, where as a society, it makes us uncomfortable to talk about mental health. Now, Jay, got to give a little plug.
Okay.
You know that the city and the county are nationally recognized for incredible parks and trails.
I do.
This is the most beautiful time of the year in Tallahassee. The weather is great. In fact, I don't even think there's a cloud in the sky right now. How important is it to get outside and get physical activity for your mental health during these incredible times?
It's vitally important, and there's a couple of reasons for that. One, it's easy to do here because we have such a beautiful park system, and it's so accessible to folks who live here. The other thing that goes into this, and goes back to what we were talking about anxiety being a physical experience. Exercise is a great way to deal with what's going on right now. Just a great way. And again, it comes back to physiology. Not only does it make you healthier, but sustained, even moderate exercise, even walking, actually contributes to release of endorphins in the bloodstream that are the body's natural way of making you feel better.
Right.
So it's, we've all got access. If we're physically healthy enough to engage in exercise, we've all got access to that. And again, it doesn't have to be going to the gym because those are closed. It doesn't have to be going swimming. Go for a walk.
Right.
Especially right now.
Right.
And I 100% guarantee that you feel better after that.
I agree. Now, with that, let me give a plug. Because the city of Tallahassee, along with Leon County, we are taking our baby steps along with the state level to open up some of the facilities. And on Friday, we will be opening up a few of the tennis courts, a few of the pickleball courts. We're opening up both golf courses. We're opening up a couple of the basketball courts for individual play. Like you want to go shoot some hoops by yourself. And we are going to open up the Truesdale pool by reservation only for laps. Every decision that we are making with the blessing of the healthcare community. I talk to the hospitals almost every day and make sure that our numbers coincide with our decisions and support the decisions that we make, and feel very comfortable that we are all on the same page. But my point is this: as we talk about physical activity, we are actually starting to make some strides to provide some more opportunities for physical activities besides just enjoying the passive trails, either walking or jogging or riding your bike or something. But it is gorgeous. I mean, let's get outside.
It really is.
Spend some quality time, have fun. Real quick, tell us some contact information. If you have somebody that wants to contact either 211 of the Big Bend, that's an easy one, but also the Apalachee Center.
Absolutely. Well, one of the things that we've got in place in the Apalachee Center is a mobile response team, and so that means we've got master's level prepared clinicians who've very experienced in mental health issues, and they're on call 24/7. And you can contact them at 1-800-342-0774. That number again, 1-800-342-0774. In Leon County, those folks will not only talk to you through whatever kind of issue or crisis that you're having, but if you need to see somebody, they will come out and see you in the community, in your home. Again, that's 24/7. And this is actually a pretty great resource for our community. We've only had this for a couple of years, and we've already had some great response. Calling that number isn't limited to folks who are in dire emergency. If you've got a question about mental health resources, if you've got some direction you're looking for, you can call that number. As the mayor pointed out, you can also call 211 Big Bend. The other thing that you can do is go to the website of the Mental Health Council of the Big Bend, which is at mentalhealthcouncil.org, Mental Health Council, all one word. And that has links, and I think we're up and running right now. That has links to a mental health provider directory that can show you where you can get help and things like insurance is accepted, what the specialties of the doctors are. So, and I really like to make sure that we have the opportunity to talk about that, especially in Mental Health Awareness Month, because we have taken such great strides as a community over the course of the last 5 years to make sure that access to mental health services is, first of all, it's certainly better than it's been in a long, long time, if ever, and it's better than most communities. Shoot, I would say I would stack up Tallahassee against any community in Florida.
I agree. The professionals that we have here in Tallahassee are absolutely fantastic. That was actually one of the questions that we received was, hey, I've never sought mental health guidance or help ever, but how do I do it? Look, it's as simple as picking up the phone, checking out the website. I mean, there are so many different ways now that you can, even if you just want to talk to somebody, reach out, do it. It's just a matter of picking up the phone, calling the number. The number one more time, Jay.
Number one more time, 1-800-342-0774.
So look, if you feel the need that you want to talk to somebody in confidence as well, feel free. Please give us a call. This is Mental Health Awareness Month. We are in some interesting times, and we are all here to help. That's one thing I love about Tallahassee. We are a community that loves each other, and we've got tremendous resources that are here as well. Another question for you real quick. What are your thoughts on mental health therapy apps like what is it, Telespace and BetterHelp.
Well,
Talkspace, excuse me.
Talkspace.
I don't have my glasses on, Jay. I'm trying to read this here.
One of the things we've seen over the course of the last few years has been this real explosion of talk therapy apps, and one of the cautions that I'd throw out to the community is that there's not really an accrediting body for any of these. So there's
Interesting.
Yeah, there's no one kind of leaning over the shoulder of these apps or the folks who are promulgating these apps and promoting them and saying, okay, let's see what your proportion of licensed folks are, etc. Now, that said, you really want to be able to have as wide open access as you can
Sure.
to mental health services. But one of the things I'd really recommend is if folks are looking at getting services through one of these apps, find out if the person on the other end, because you're not talking to a computer, you're talking to a person. You got to find out if the person on the other end is licensed, where they're licensed, what they're licensed as. And another, I think, big tip for this is, are the organizations that are promoting the apps accredited by things like the Joint Commission or an organization called Carve? These are all national accreditations. Apalachee Center has been Joint Commission accredited for 40 years. These are all national accreditation organizations that can kind of separate somebody who just wants to hang up a shingle from somebody who's got the
Sure.
requisite experience. And
Sure.
you kind of want to be sure about that. But I'd say the technology is great.
Right.
It's one of the things we've kind of leaped into in
Right.
the last couple of months. You got to find out who's on the other end of the phone.
It will be interesting to see how it shapes the industry moving forward. At the same time, hey, I'm partial. We've got great resources right here. We've got people right here in our community that are ready to help. That are simply just a phone call or even an email away.
Absolutely.
So, take advantage. Even if you just want to pick up and talk to somebody for, a minute or two, or you take that first step, please do. Please do. I think we got time for one more question. So, hey, here we go. What are some tools couples can use to navigate this difficult time? I was having a virtual chat with a friend the other day. They were talking about how he and his spouse got in a bit of an argument over how to rearrange the spices in the cupboard. And I think that we're all finding ourselves in situations where, because it's such close quarters and we're
Right.
spending so much time together, even the littlest, silliest thing can cause tension or anxiety. So talk to me, Jay.
Well, if you look at it, right, it goes back a number of years, but I did a lot of couples counseling at one point earlier in my career, and in the modern world, traditionally the issue with couples and couples compatibility has been folks don't carve out enough time for each other. They're
Right.
busy with their careers, they're busy with their own lives, they don't make each other a priority. That's where, concepts like date night came from. People who ordinarily were just missing each other because they were consumed in their own lives. Well, we flipped that on its head in the
Right.
last month.
Right. Right.
So all that energy that's been bringing people towards each other, well, they're towards each other now. They've collided.
Right.
So I think the best thing couples can do when they're, at that, actually even before that point of tension, I don't think you want to wait for that to happen, is to really carve out space within the relationship. So I actually think that this is a good time to make sure that there are parts of the apartment, parts of the house, activities that you do that are separate from each other. And I think the reason you do that is that if you're used to seeing your, partner, spouse, if you're used to seeing them 5 or 6 hours a day awake, you're seeing them 24 hours a day now.
That's right.
If you're used to seeing somebody a couple of times on the weekend, you're seeing them throughout the weekend now. And that's actually okay. And that's something we haven't said as a profession in a long time, is it's okay to have space between yourself and your partner. But the thing is, that space is actually as important as the closeness. That's kind of how you maintain your separate identity together. Now, this is the time when that's what you got to look at, and that's what you got to prioritize.
Folks, the month of May is Mental Health Awareness Month, and on top of that, we are all experiencing the global pandemic. I want to thank Dr. Jay Reeve, my good friend, CEO of the Apalachee Center, an incredible facility right here in Tallahassee, for joining me for this conversation.
Thank you, Mayor.
Again, as we concentrate on the physical health aspects of COVID-19, it's important that we continue to elevate the conversation on the mental health aspects of COVID-19 and what we're all going through. Jay, the number at Apalachee Center one more time.
One more time, number at Apalachee Center, 24 hours a day, 7 days a week, 1-800-342-0774.
Or 211 Big Ben. Both of them are great resources. We've got a lot of great resources, a lot of dedicated men and women right here in our community
Yes, we do.
that are willing to help. If you need help, just pick up the phone, shoot an email. This is a great community. Jay, thanks
it
for
is.
joining.
Thank you for having
Really
me.
appreciate it. Thank everybody for tuning in. We got a lot of great questions. Thanks for sending them in. And Jay, I look forward to seeing you soon.
Likewise. Thank you, Mr. Mayor.
Be safe.
Thank you.
Thanks for joining.